Of all the cancers American men encounter, prostate cancer is the most commonly diagnosed and is the second leading cause of cancer death. Considering those rates, it would seem that a method of screening to detect the disease would be of great service to medical care. However, there has been little consensus regarding prostate cancer screening. The PSA, or prostate-specific antigen test, is a blood test that seeks out a specific protein that is produced only by the prostate. The higher a man's level of PSA, the greater the likelihood he has prostate cancer. If it is determined that a patient meets this criteria, then it is often recommended that a biopsy be taken from the prostate.
Right now, in the last 20 years, we've reduced the death rate from prostate cancer by 42%. 20 years ago, the 10-year survival from prostate cancer was 55%. Now it approaches 99%. So clearly we're doing something right.
The issue surrounding prostate cancer is that a large portion of tumors are not significant enough to warrant treatment. Earlier studies have indicated that as many as 40% of men who receive a positive test result have cancer that is growing too slowly to be a deadly threat. The ensuing biopsies, radiation surgery, and other treatments can incur serious adverse effects, including impotence, incontinence, and other complications, potentially even death. That's the argument behind why the panel advising the U.S. government on medical treatment guidelines, the U.S. Preventative Service Task Force, or the USPSTF, recommended against screening healthy, symptom-free men of any age.
This type of one-size-fits-all approach makes completely no sense to the vast majority of practicing urologists, and from our perspective threatens to undo 20 years of progress in patient education and treatment.
A number of experts strongly believe that the PSA test still plays a necessary role in prostate cancer treatment. Without the blood test, the only remaining option for seeking out prostate cancer is through a digital rectal exam, where a physician examines the prostate through the rectum using his or her fingers. Some tumors can be detected this way, but not others, and often this discovery is too late.
It's very important that the only way that we can get the results that we've enjoyed is to catch the prostate cancer before it has become metastatic. Once prostate cancer has escaped the confines of the prostate, there is no probability for cure. So our emphasis has to be on early detection. And this is why we find some of these controversies to be bewildering. A PSA is not an obligation to undergo a biopsy, and if you're biopsied, it is not an obligation for you to undergo treatment. It is simply a piece of information that a man can use to have a more educated discussion with their healthcare provider and their family about what approach is right for them. This is why I take significant issue with the USPSTF. A man has a right to know what is going on in his own body.